All right, good afternoon, everyone. Thank you so much for joining us this afternoon. We're going to get started because we only have 45 minutes, but people can join as they wish. I'm so pleased to welcome you all here. I just want to quickly draw your attention to the closed captioning. I hope you can all see it, but people have
Yeah,
really, yeah,
I know.
people have really appreciated that. I'm actually going to mute everyone, and definitely feel free to unmute yourselves if you have a question. I am going to be recording this session, so if you have questions and you don't want to ask them publicly, please chat them to me. I will ask them on your behalf, and I will not say who asked them. You are also welcome to unmute yourselves and ask them, of course. And we also have a list of questions that people have already asked. So you're welcome to just sit back and listen as well. So we are the first senior center that's doing this, and I'm very proud to say that. So thank you all for participating in this innovative program. And without further ado, I'm thrilled to introduce Nancy Koppelman to you today.
So welcome everyone, and thank you for joining our virtual Aging and Memory Loss Roadmap Education Q&A series. We are grateful to have so many people here. My name is Nancy Koppelman, and I am the co-director of outreach at the Center for Alzheimer's Research and Treatment at Brigham and Women's Hospital in Boston. Today, we will present the Q&A for the first part, Roadmap to Dementia Diagnosis. A little background, the Roadmap series is a four-part comprehensive program about aging and memory. The series is a culmination of a couple of years pulling materials together in being in the community and at neighborhood health centers. People and clinicians asked us to prepare this to help guide those people walking this road. A few details, you should have all received your electronic companion guide for today's presentation. If not, email it to, and we'll send it to you. We will also send you an evaluation form for today's program. Please complete as we value your feedback and sign up to join our education registry. I would now like to introduce our speaker, Dr. Doreen Rentz. Dr. Rentz is a professor of neurology at Harvard Medical School with dual appointments in the departments of neurology at Brigham and Women's Hospital and Mass General Hospital. She has worked as a clinical neuropsychologist for over 30 years. Her research interests include early detection of cognitive and behavioral changes in preclinical Alzheimer's disease using novel cognitive assessments, as well as amyloid and tau PET imaging. Now I'm turning it over to Dr. Rentz to answer your questions.
Thanks, Nancy. And thank you, Alana, for having us. I wish this was in person, the video, but thank you so much, all of you, for coming this afternoon. I just wanted to say a few words about Alzheimer's disease and then open it up for questions. I think you all know that Alois Alzheimer, this disease was named after him when he met Augusta Dierder at the Frankfurt Asylum. Her husband brought his wife in to see Dr. Alzheimer because he was concerned about her. She was losing her memories and forgetting who he was. And this was new to Dr. Alzheimer. So he followed her for several years, and then she passed away. He then took her brain and under an autopsy discovered these unusual changes that were going on in the brain called amyloid plaques and tau tangles. And so the disease that we know of as Alzheimer's disease was named after him because he was the first to discover this. We haven't, found a treatment yet for this terrible disease, but we all know that it's a slowly neurodegenerative process. That means we slowly begin to lose some of our memories, an appreciation of who we are, and eventually the ability to take care of ourselves. The key, though, that we know today is that these changes in the brain are really occurring 15 to 20 years before you become forgetful. Once you become forgetful, there's quite a lot of these brain changes already having taken place. And what we would like to let everybody know is that it's early diagnosis and early treatment that really becomes critical. Now, even though we don't have a treatment for Alzheimer's disease right now, there are opportunities to participate in what we call prevention trials. These are for people who do not have memory problems yet, but are at risk for going on to develop them. And when we say at risk, what we mean is you might have had a family member, mom or dad, who suffered from memory loss. And that puts you at greater risk for going on to develop Alzheimer's disease yourself. So in part, some of these educational programs are really to inform you that while Alzheimer's disease doesn't have a formal FDA approved treatment to reverse the disease, that we do offer at Brigham and Women's and Mass General these opportunities to participate in a clinical trial and to somehow optimize your abilities. In all disclosure, my husband has early Alzheimer's disease and he participates in a clinical trial. And I'm glad he does because he's been in this trial now for the last 3.5, 4 years. And it's really helped him to maintain an optimal quality of life. He doesn't always remember stuff, but right now he's out in the garage fixing the snowblower. So he still has an ability to fix things, to do stuff around the house. He still drives to the store. So there are many things that he's still able to do that had he not been in a clinical trial, I'm afraid he would be a lot more deteriorated than he is today. But I want to open this now up to all of you and thank you for coming. And if I can answer your questions, I'm more than happy to do so. So why don't we start?
Thank you, Dr. Wren. So at this point, I am going to just start with one question, but if you think of questions, please again, chat them to me or just unmute yourselves. This is going to be very casual and we want you to have the opportunity to ask questions. So actually, before I begin, does anyone have a question? And if so, simply unmute yourself, please. If not, I will start with some that I have. Okay, so Dr. Renz, the first question someone would like to know is, when should I be concerned that my memory and thinking has changed enough to contact a professional for an evaluation?
Oh, that is an excellent question. You know, I am a professional and expert in memory loss, and I refuse to recognize it in my husband. And then finally, it reached a point where I realized I couldn't ignore it anymore. Now, if you are having trouble remembering that movie star on TV, that's normal. If you're having trouble remembering where you put your keys, that's normal. If you what you find your room for, that's normal. But when you start forgetting salient events, things that you should have remembered, and the event that really triggered me that my husband was having real problems was when our son gave us a camera for Christmas. And this was a couple of years ago, obviously. And, you know, we're old, so it took us a while to figure out how to use this camera. We took it on vacation. We took pictures with it. Then we figured out how to get the pictures off the camera and onto the computer. And a couple months after that, my son says, "Hey, Dad, remember that camera we gave you for Christmas?" And he had absolutely no recollection of that camera. And he kept saying, "No, Mike, well, you never gave us a camera." And I even went upstairs, got the camera, brought it down, and he still didn't quite remember that we had gotten that for Christmas and actually used it. So it's salient events like that that you think that they should remember. If you went to a wedding and they can't remember it, these are the things that you want to alert yourself that I really need to get some help. One of the first things that people actually do memory-wise is they get lost in familiar surroundings. They're driving and then they forget to get off at the exit, or they don't recognize the familiar landmarks. They can't find their way to the mall anymore, even though they've been there a million times. These are kinds of things that aren't normal and should alert you to get professional help.
Makes sense. And how can I set up an evaluation for my memory concerns?
Well, the first thing you should do is tell your PCP. Now, your primary care doctor may not always believe you. I know my husband's didn't. He said, "Oh, you're just like everybody else." But if you really feel like this is important to you, and it should be, then you should contact the Department of Neurology. There are three really excellent memory centers here in Boston. One at the Brigham, the Center for Brain Mind Medicine. There's one at the MGH called the Memory Disorders Unit. And there's one at BU Medical Center, which is also the Alzheimer's Disease Research Center. So there are really top-notch places where you can get neurological care from specialists in neurology who really specialize in dementia. And we're blessed when we live in this city to have quite a number of really excellent neurologists around who can help you.
And how can one find out about prevention trials?
Oh, well, we actually have a prevention trial that's just starting up. Dr. Risa Sperling, who I've had the privilege of working with for over 30 years, she is the principal investigator of the AHEAD study. And this is a drug trial, prevention trial. And what it does is that it constitutes a medicine that actually removes one of the proteins of Alzheimer's disease from the brain called amyloid beta. Amyloid beta is probably the beginnings of the Alzheimer cascade. And eventually you begin to get the tau tangles. And it's when the two of those marry and start to deteriorate in the brain that it begins to cause the memory loss that we consider a part of the dementia. But anyway, feel free to give us a call. You have our materials, and we're more than happy to see if you would qualify for a prevention trial. Now, there's more than just one type of prevention trial. There are other exercise trials that are non-pharmaceutical related that really try to incorporate exercise, good eating into your diet, and that these things have been shown to be preventive. The one that's running in the United States and is actually being conducted at Butler Hospital, if we ever get over COVID, is called the Pointer Study. And the Pointer Study is really this incorporation of a lot of exercises and healthy eating, intellectual stimulation, social engagement. These are the things that really help prevent the further decline of the disease. Let me just say this. You can't really, if you get Alzheimer's disease, you can't really prevent it. What you want to do is to be able to stall it, to halt it in its tracks. And that's what these prevention trials frequently do. And that's what I think is happening with my husband in some respects, is that it's really slowed the process down, allowing him to live a full and active lifestyle much longer than I think he ever would have.
So something difficult talking to family members who you're concerned about. Someone has a family member who is seeming more forgetful and not able to do all of the things he's done in the past. For example, he's having trouble getting onto the computer, paying his bills on time. How do I talk to him about this?
It's always good to just be honest. I mean, that's what I did with my mom. That's what I did with my husband. When you have concerns, you should really raise them in a way that's non-confrontational. When you begin to lose your memory, you get pretty defensive. You say, well, you never told me that, and what I did with my husband is just sat him down and I said, I'm concerned. I'm concerned that you are becoming forgetful like your mom. His mother had Alzheimer's disease and she lived with us for 3 years. So we grew up with a front row seat of what this disease was like. And he didn't want to go down that road. He didn't want to become like her. So he was open, he was really open to doing whatever he could to help prevent or halt or stop this disease process from happening to him. So it's frank, honest, open communication in a non-confrontational manner that really just shows that you're concerned. Sometimes, you know, you may need to call on the kids to come and be involved in this conversation. Having the whole family involved, it can be really powerful because as the spouse of someone who is beginning to decline, it's a lot of burden, you know, to carry alone. And having the family on board to know what you're doing and how you're doing it is really beneficial all the way around.
Thank you, doctor. And this question also relates to the family or possibly genetic basis, although you can answer that question. My husband is having problems at work. He's becoming more forgetful and more isolated. His father had Alzheimer's disease. So how concerned should I be considering that his father had Alzheimer's disease?
Concerned. You should be concerned. You know, when you have a primary family member who had the disease, that means you have a 25 to 50% chance of getting the disease around the same time that they did. So I would be concerned. And in fact, I still see patients. So you'd be amazed how many patients that I see who really come in early, you know, because they had a risk for the disease. They watched their mom or their dad or their aunt, you know, suffer with the disease. They started to become forgetful, and they were proactive and wanted to get at least a baseline evaluation of their memory so that we could follow it over time. In fact, there are studies now that we've discovered that subjective concerns about your memory may actually be predictive of future decline down the road. So the fact that you have some concerns is not a bad thing. It's a good thing because you want to be able to incorporate into your life those activities that could either slow or halt this disease process. And you will also have the opportunity to participate in a clinical trial. Once you get too far down the road and you're like moderately demented, there isn't much we can do for you. And that's the sad thing about the disease. And there aren't a lot of clinical trials that drug companies are developing for later stages of the disease. And most of the people in later stages get treated with more psychiatric forms of medicine to keep them calm, and to reduce their hallucinations or their delusions. But when you're early and all you have are concerns, it's really good to check that out. And a good memory evaluation, along with a neurological evaluation, if that's recommended, is the way to go.
And you mentioned a few centers, I think BW and MGH, but someone is asking, my primary care doctor says that my wife is fine, but I am noticing changes and I really want to get her checked out. Where do I go to get my wife evaluated?
Yeah, you know, contact us and we will put you in touch with the clinics that you want to go to. You know, like I told you, my husband's PCP kept saying, oh, you're just like all the other patients I have. And in fact, when my husband's mom was really starting to show, I mean, it was obvious she was having memory problems. Her PCP was in denial. And then like 6 months later, he gave us a call and said, she was living down in Florida at the time. And he gave us a call and said, you have to do something about this. You need to take her in with you. And we did. That very weekend, we brought her home with us. But you don't want to work in a crisis like we did. That's not an optimal way to take care of your loved ones. It's better to be proactive and plan ahead. So we'll be happy to, Nancy is great at this. She'd be happy to guide you along finding an appointment. If you're really interested in clinical trials, we even have what we call a rapid diagnostic clinic. And this is a clinic that's really designed for people who want to do something. They don't want to sit on the sidelines. They want to participate in research, but they need a diagnosis. And so the Rapid Diagnostic Clinic was set up, run by several of our wonderful behavioral neurologists, along with Allison Beatrice, who's a physician assistant. They will, see you, give you a diagnosis, and usher you into a clinical trial if you qualify. So do something about it.
Great. And another related question about these wonderful centers. It sounds like my husband has a family history of Alzheimer's disease. His PCP referred him to a neurologist. However, would it be more beneficial to go to one of the major centers that you are recommending?
Obviously, I'm biased, but yes. Neurologists just, they specialize, in what they're really good at. Some specialize in multiple sclerosis, some specialize in headaches, some specialize in motor neuron disease. And we have doctors that specialize in neurodegenerative diseases or Alzheimer's disease. It's one thing if you lived in a rural area and you didn't have access to the best care, you would have to do with what you could. But, if you've got the best, I don't know why you wouldn't go there. It's really just important.
Great. Is there a way for me to monitor my memory concerns from home during this pandemic?
Oh, what a great question. We have more and more tests that we're trying to do remotely. One of them is the Brain Health Registry. That's already up and operating. So if you type in, and maybe Alana, you can write down the Brain Health Registry for your clients here. They actually have some cognitive tests that you can do on a repeated basis if you want to do that. We have also a registry of people who are willing to help us to develop remote tests that will monitor your memory. Those are the ones I can think about right now. In the little booklet that was sent to you, you might get a few more recommendations than I can think of off the top of my head.
Great. Someone would like to know, what do you know about the Boston Center for Memory?
It's a freestanding memory center. It does do some clinical trials. The unfortunate thing is it doesn't give you necessarily the quality workup that you would get at Brigham and Women's or Mass General. A lot of people go there because it's close, but I also know people who have gone there who have been dissatisfied because their needs really weren't met. And one thing I got to say for the institutions that I've recommended is we treat you like you were related to us. We care about you. We really want you to have the best. But they do some memory evaluations, but they don't necessarily do the careful job that I think you deserve.
Hi, can I ask a question?
Yeah.
Okay, so let's say you're interested in going to Brigham.
Yep.
Do you just call on your own, or do you have to go through a primary, or can you just call and refer yourself?
No, you can be self-referred. I mean,
Okay.
I have seen patients being self-referred. You can contact me if you want a neuropsychological evaluation. I'd be happy to facilitate a referral. You can call Nancy Koppelman. I mean, our numbers are there. She can help facilitate a referral. Depends on your insurance,
Okay, so speaking of insurance, so if we have Medicare, Blue Cross Blue Shield, is that good?
That's
Okay.
Yeah,
All right.
In fact,
And-
I only see Medicare patients. So,
Okay.
because not many people want to see Medicare patients nowadays. They want
Oh,
the big bucks. They don't, Medicare doesn't always pay as much, but I only see Medicare patients. So,
and
I-
and you mentioned something about a little booklet. What little booklet? I don't have any little booklet.
oh, Nancy, did you not?
So I believe that Alana sent out the e-companion guide that went with the presentation that you might have seen before this.
Oh,
Did you
could-
get that?
I might have gotten it, maybe just ignored it.
I can
say.
resend it. I'd be glad to.
Okay.
If you want to put your email in the chat, I can send it to you.
Okay. All
Sure.
right, that's great. And speaking of the trials, to be a participant in the trial, what I imagine that it all involves different medications. So what are the side effects or some of those medications?
Well, sometimes it involves medications. If you want to do a drug trial, then it would involve medications. They are all approved by the FDA to run these trials. So, and the side effects of these medications will be fully explained to you before you ever get enrolled in a trial. So,
Okay. So I
there are
didn't think that,
ones,
I'm
but-
sorry. I didn't think that the trials was anything but medication. So what kind of trials do you have?
We also have observational trials. So let's say your memory isn't as bad as that would require going into a drug trial. We would love to study you and follow you. And we have a number of different trials that are looking at subjective cognitive concerns. They're looking at the development of assessments like remote assessments that measure your activities of daily living. We have all kinds of different types of observational trials. Some of them are actually looking at your sleep because we realize that sleep may be a critical component. And if you don't belong in a drug trial and you want to play your part in helping us find a cure for this disease, participating in these observational trials where we learn more about the disease so that we can target risk factors that we need to be aware of. Participating with us would be wonderful. The other thing about observational trials too is the fact that we will follow you more closely than your PCP ever could. And if you develop some new symptoms, we can catch it right away and really help facilitate your care. So anyway, participating in research always has a negative connotation, like I don't want to be a guinea pig. But on the other hand, there's a lot of safety and precautions and ethics boards involved before a clinical trial or an observational trial gets started. So we have your safety in mind, and you would really be a soldier in the army against fighting Alzheimer's disease and other neurodegenerative diseases if you participated in this research.
Well, I think it sounds great if Ilana could, send out another email with your with your name and address and email, and perhaps the Brigham and Women facility, because my husband, I've noticed that there's been a number of changes, and his mother did have Alzheimer's.
Yeah.
So I know he's been worried about his memory for a while, and I've really noticed. I mean, I try not to make a big to-do because I know he gets anxious and upset, but I do think that perhaps joining in one of these trials would be beneficial for him and for others.
Absolutely. And, now is the time
Yeah.
to do that, because you don't want to wait till it's just so bad and so obvious.
No, I'm afraid.
Yeah, exactly. So was
Yeah.
I can totally empathize with where you're at.
Yeah. So if a person just like, I find that with myself, now my mother didn't have that, but I find that sometimes I'm trying to think of a word which is just at the tip of my tongue, and I just can't get it out, and I'll remember it a short while later, or even hours later. So is that a sign, or is that just age?
No, that's probably normal aging.
Okay.
It happens more frequently in women. There's something about menopause that causes women to undergo word finding problems. You can't come up with a word. And the more tired you are, the worse it is of trying to come up with a word. My husband always jokes about me, you think I'm bad, but you can't even say what you want to say, because I know that I'm tired and I know that I'm not having trouble. I'm having trouble coming up with the word I want to say.
And we probably have a better vocabulary, so we have more words that we can't remember.
Exactly, exactly. We can talk around it too.
Right. Okay, I would definitely like to contact the Brigham and yourself regarding my husband. First, I have to speak to him and put it to him nicely, but I know he's been concerned himself.
Yeah, and you know what? If it all turns out that it's nothing to be worried about, then you don't have to worry about it anymore.
Well, and even if it does, there's nothing we can do about it. We'll just have to do the best we can.
Well, and if it is, then you plan ahead.
Right.
You become proactive. Exactly.
Thank you.
You're welcome.
So I will resend everyone the guide and the video with contact information. Dr. Wren, someone would like to know how to contact the Rapid Diagnostic Clinic.
Nancy, you have the number.
Yes. Well, what I would suggest is that you reach out to me via, Alana's going to send my contact information, and I also just put it in the chat. So write to me and I will put you in touch with the person who runs that. So.
Yeah, you can't, you need to schedule an appointment. It's not like a walk-in clinic.
No,
Of
it's
course.
not. Right. But the thing about the Rapid Diagnostic Clinic is for people who are really interested in participating in research, it's a way to get in quickly and get a diagnosis so that you can, participate in research. So it's a wonderful option to have, especially when you're interested in research.
So someone likes to play games with their family and they're having trouble remembering how to play the games. How concerning should that be?
That's a concern, particularly if you used to be able to do it well. Some of the early signs, they're more are related to this. For instance, like not knowing how to get onto the computer and used to always be able to know how to do it, playing games or forgetting the rules. These things are concerning. They're more concerning than being unable to come up with a word. Because these are habituated actions that get embedded in the brain in a way that like driving a car does, where you don't have to think about it anymore. You just automatically do things. And so when that begins to fail, I think that's an early sign. It's something to trigger you to seriously consider going to the doctor for.
Good to
I
know.
have another question.
Yeah.
If you don't mind, if a person goes to the clinic, let's say, and they want to be part of the trial, are there psychologists or social workers or someone that will help them? Because I imagine it's quite traumatic to be told that, yes, you have early form of Alzheimer's or something.
Yes, you have the best care ever. You will get counseling. We do have social workers, we have psychologists, and our behavioral neurologists are wonderful.
Okay.
They've communicated this news a million times along with myself, and you care about people. So yes, you would, it's not, this is your diagnosis and out the door you go,
Right.
We want to embrace you and tell you what your options are. You'll come back and see us. And that's the advantage of a clinical trial, is the fact that you have repeated appointments. And I got to tell you, the people who actually do participate, Nancy runs our Research Ambassadors program. They live for those appointments because they get to see each other in the waiting room, and they share with each other. It's a real support system.
Mhm.
We even have support groups, for people who want even more additional support. So, and that was the main reason why we wrote the book Roadmap to Diagnosis, is because too often people are alone in this journey and they don't know what to do. And I remember, and how this all got started was my husband had needed hip surgery. This was a number of years ago. And we had to go to Newton Wellesley to hip surgery class. So I thought, what? So anyway, we go to this class, and there's a whole group of husbands and wives, generally, who were sitting around the table. And she passed out this book. And in this pamphlet was, what is hip surgery? When do you need it? What do you have to do before? 7 days before, the day before? What happens at the surgery? What happens afterward? I came back and I said to Nancy, we need one of these for Alzheimer's disease, because people get a diagnosis and then they walk out the door and they wonder, what the heck am I supposed to do now? So these pamphlets are really helpful because they're detailed. They tell you what the resources are that you need, what you should be thinking about in the future. And in fact, the Governor's Council, these books may actually become a part of the Commonwealth of Massachusetts through the Governor's Council, because they're valuable and they're specific to Massachusetts. So all the resources are really local.
And how easy is it to get an appointment for an evaluation at the Brigham's?
Well, it depends on the appointment. It can be several months down the road to see a behavioral neurologist, but in the rapid diagnostic clinic, it's weeks away.
Yes.
Okay.
Okay,
Thank
you
you.
got the milk? Okay.
Dr. Renz, how is your work affected by COVID-19?
Well, for a while there, from March till 1, we really weren't going in and seeing patients. But around September 1, I started to see patients face to face again. And, we have to wear masks. I have a plexiglass in front of me. When you come in as a patient, you get screened. And it's pretty safe. I don't know. I find it safer than riding the T, because people are really looking out for you. But the clinical trials actually stopped for quite a few months. And so even my husband couldn't go into the clinical trial for 6 or 7 months. And that was upsetting at some level because, but it was done for safety reasons, Now things are starting up again. Vaccines are becoming available. I go for my second shot in next week at this time. My husband's going to get his shot. So eventually things are going to open up a lot more, and we'll go back to quasi normal again. Some of my colleagues are actually doing virtual appointments. They do it over the video like this. They talk to their doctor. Some people are actually doing cognitive testing over the video. I'm too old to do that or learn how to do that. So. And you'd be amazed at all the people who really want to come in to see me. They don't want to do it over the phone. And so I'm one of the few providers that I just see face to face, and people are appreciative of that. Also, if you have hearing problems or seeing problems, it's a lot more difficult to do stuff over a video like this.
And how would one talk to their family about their dementia diagnosis? Difficult conversation to have.
Yeah, it all depends on your relationship, obviously, but I think you just sit down in a calm way and talk about your concerns and your worries. And if you've actually received a diagnosis, to bring the family together and be upfront. I found early on in my career, I used to be afraid to tell people that they had Alzheimer's disease. And I used to kind of couch it in all kinds of terms. And then I found out, with aging, you get wiser, that people just want to know, and to be honest and truthful about what you think, what's going on. And that's the way I treat my patients. I ask them, do you want to know what I really think? First of all, I ask them how they think they're doing. And then I usually say to them, do you want to know what I think? And almost 99.9% of the time they say yes. And they're grateful because now they have an answer to why they're having the problems that they're having. And if it's not Alzheimer's, if I think it's just normal aging, they're like relieved. They're glad, to know that they've been worrying all this time about something that really is pretty normal. So anyway, honesty is the best, I think, the best means for communicating with your family. I know with my mom, when she got to be in later ages at 91, 92, she and I sat down quite frequently, every 3 or 4 months. And I would ask her, well, what do you want? If you were in the hospital, what would you want? When you die, what do you want? And I mean, these aren't easy conversations, but depending upon your relationship and the communication, that you really want the best for them, that you're their advocate, you really want to help, I think goes a long way.
Thank you for that. I think we have time for 1 or 2 more questions. So does anyone want to unmute themselves and ask a question? I have a few more, but certainly.
Hi, I'd like to ask one question. I don't know if it's a quick one or if somebody else wants to say something, but what is the difference between Alzheimer's and being diagnosed with something like Lewy body dementia? Because a friend of mine, her husband, well, they've passed away since now, but we thought it was Alzheimer's, and then it turns out they said it was, after quite a while, they said it was, no, it wasn't. She was happy about it, but I didn't think it was very good to hear that.
Lewy body disease, often the underlying pathology of these diseases is what defines them. So I mentioned Alzheimer's has plaque and tangles. Lewy bodies has alpha-synuclein kind of deposits, but they also have plaques and tangles. And that's why Lewy body disease frequently gets confused with Alzheimer's disease, because the underlying pathology is often the same. But what's different is the clinical presentation. So in Lewy body disease, you have the kind of shuffling gait that you frequently see in Parkinson's disease.
Okay.
You have fluctuations in your ability to attend and concentrate. Some moments you're really sharp, other moments you're not. You also have what is known as visual hallucinations, where you see things and the person themselves knows they're not real, but they communicate with them. So these unusual kinds of clinical manifestations that you don't see in Alzheimer's disease are really prevalent in Lewy body. But in Lewy body disease, the disease frequently occurs earlier in life. That's what Robin Williams had. Remember
Yes.
the comedian?
Yes.
And he got it in his 60s, so it happens a little earlier in life, and the clinical presentation is a little different. But in the end, the underlying pathologies are pretty similar.
Okay, thank you.
Any final questions? I have one final I can ask you, Dr. Renz, if you have 1 more minute.
Sure.
Are there any medications that can prevent memory loss, and how in general can I prevent memory loss?
Don't go to the drugstore and buy Prevagen. That's not going to help you. There are no real medications to directly target memory loss that are FDA approved and work. But what does work is staying healthy, so visiting your doctor on regular appointments, I take vitamins, you want to make sure that your vitamins, you take a multivitamin or take vitamin C to improve your immune system. There are, staying healthy is probably the best medicine that you can do. Exercising is another way to maintain optimal brain health. But there aren't really medicines out there. Even the ones that are FDA approved for Alzheimer's disease don't really help your memory. So until we get a disease modifying drug that actually removes some of the pathology from the brain, the hope would be is that that would help us to maintain our brain health and our memories.
Very good to know. And Dr. Enns, I know you have a patient after this, so I want to thank you from the bottom of my heart for holding this this is fabulous, so informative. And I want to thank Nancy Koppelman for arranging this program and contacting me. And I do want to plug the next 3 programs. We're going to be here on the first Wednesday of March, the first Wednesday of April, and the first Wednesday of May from 2 to 2:45. And you hopefully signed up for all of those dates, but if not, you can certainly do so and contact me. I'll put my email address in the chat. So thank you so much. Nancy, did you want to say anything to close us out?
It's just
Or Dr.
it's a pleasure to be here with all of you. It's been really great to meet you virtually, and if I can do anything to help, please feel free to be in touch.
Yes.
Thank you.
Everybody.
Thank you.
Stay
Thank
healthy.
you
Very much. Yeah.
Bye.
Bye.
I thank you very much.
Yeah, bye.